Hi. Last weekend I was doing my men's health Shockwave course, the 2-day version that I really enjoy to do in the clinic. And the reason why I enjoy to do it here is that I have all the different kind of Shockwave devices. I have electromagnetic, electrohydraulic, and piezoelectric. So it gives a really good opportunity to discuss how different devices can affect different problems and how you can combine or what can be the best solution for each indication. What also crossed my mind is that a lot of people, they stay within that one device because they will never get exposure to it. Next week I'm going to Bogota for the ISMST yearly conference, and we're gonna be maybe 250 or 300 people, and that's not a lot compared to how many people are using Shockwave globally. So how can we do better for our patients? We can do it in the way that the people that are experienced users really try to inspire people to just try everything. Instead of saying, I only know this device, and if you don't have this device, it's bullshit. Then try the different devices before you decide. I had one calling me last week asking for what device to choose, and I basically said there is these options. Reach out to each company, talk them through what you want to achieve, try the devices, and then figure out what makes best sense for your clients. So if you come to a course in my clinic, or if you want to have one-on-one, you have the opportunity to try different devices. It makes your decision process easier. So next week in Bogota, we're gonna see all the different devices. There's also gonna be the electroacoustic from BTL, which I don't have in the clinic, but that is the fourth kind of technology we have within the Focus Shockwave range. So try it out. And if you want to learn more about the men's health, I have the next course in January. And I'm also considering, if the need is there, should we do more courses that's focused on just the technology? I know everyone just wants to show me the protocol for this indication, but are there a base for like a ground course or a basic course in just what is the difference between the main technology of Shockwave? Because if you understand that, you can also understand the studies and you can understand why the protocols are different. After about 1.5 years with different devices, I'm starting to come to the conclusion, let's stop comparing them directly towards each other. Let's look at the patient's outcome, and then that be the determining factor of what device we use for each indication. There is no final solution. We need to adapt to the client, and when we know the client's need, we can choose the specific device. We need to look into different sizes of focal zone. We need to look into how the energy is, because the perception of energy on example 0.15 millijoules per square millimeter is not the same across different devices. So let's try it out. If you want to know more about the Shockwave technology, book me in for an hour and I'll go through the different parameters that you need to be aware of before you buy a device and offer it for your clients.